Hello, my name is Shana Yates, and I am about to demonstrate my IV push medication return through a central line. I'm in my clinical uniform, and this is my medroom. So I'm going to walk into my medroom, and I'm first thing going to clean my hands with sanitizer very well, making sure to get all of the surfaces and crevices. Okay. So first I'm going to look at my MAR, and I have patient John Brown, date of birth 12/2/1960. Medication to be administered is diphenhydramine hydrochloride. We're doing 25 milligrams IV push, and we're going to go ahead and give that as soon as I'm done drawing it up. So first I'm going to go ahead and look up the drug in my drug book. Got it marked for speed. So we have diphenhydramine hydrochloride, indicated for relief of allergic symptoms caused by histamine release. So it can be used for just seasonal allergies, or it can be used for anaphylaxis. In this case, it's going to be seasonal allergies, otherwise I'd be moving a lot faster. It does not require dilution, and in rate, it says to infuse at a rate not to exceed 25 milligrams per minute. So since I'm giving 25 milligrams, I'm just going to make sure that I give it, administer it in less than 60 seconds. Okay. So now I'm just going to go ahead and pick my drug, not that one. So I have found diphenhydramine hydrochloride, 25 milligrams per milliliter. So that is the drug I'm going to use. I have a 3 ml syringe. I've got a needle. I've got a cap for it afterwards. And some alcohol wipes. Okay. So first I'm just going to go ahead and excuse me, clean the vial. I'm going to go ahead and do this for 15 seconds vigorously. Okay. 15 seconds, throw that away. While that's drying a little bit, I'm going to get my syringe and needle ready. So first I'm going to go ahead and drop 1 milliliter of air. And then I'm going to go ahead and inject that into the vial. Now I can go ahead and draw up my 1 ml. I'm having a little trouble at the moment getting this bubble out, but I got some time. Okay. I'm going to go ahead and recap my needle because I won't be needing that. We will remove that, throw this away in the sharps container. Again, just double check. Perfect. Okay. So now I'm going to place a sterile cap onto my syringe. Okay. Place that there. Before I do anything else, I'm going to get that labeled. So I have patient John Brown. The drug is diphenhydramine. Chloride. The amount is 25 milligrams in 1 ml. I'm going to put my initials with student nurse. The date is April 3rd, 2020. The time is 1:10, so 13:10. And drug does not expire until February of 22. Okay. So I'm going to go ahead and label my syringe, not blocking any of the lines. Okay. So now I have my syringe with my label, 1 ml. There we go, got the drug. Now I just need to prepare 2 10 ml flush syringes. One. Remove the cap. I'm just gonna remove all of the air. Ooh. Go ahead and say the air's out of that one. And I'm going to get a new cap for that guy. Okay, throw that away. And I need one more. And remove the air. Okay. Recap that one with a sterile blue cap. Okay. I need a bunch of alcohol. All right, so I've got my MAR, my 2 saline flushes, air removed. I've got my drug syringe, air removed. I've got my drug. And I'm going to bring this all with me to the patient's room. Okay, so now I'm in the patient's room. I have introduced myself, and now I am going to wash my hands. Rubbing vigorously. Okay. All right, John, can you go ahead and verify your name and date of birth for me?
John Brown, 12/2/1960.
Okay, yep, John Brown, 12/2/1960, both on the armband and the MAR. And John, do you have any allergies?
No.
Nope, I don't see any on the MAR. I don't see an allergy band. Okay, we're good to go there. So first, I'm going to go ahead and verify my 5 rights. I've got my patient, John Brown, 12/2/60, John Brown, 12/2/60. The drug is diphenhydramine hydrochloride, diphenhydramine hydrochloride, and diphenhydramine hydrochloride. The amount is to be 25 milligrams in 1 ml. So I've got 25 milligrams, 1 ml. I have 1 ml drawn up in my syringe. And it's going to be administered IV push through the central line. And we're going to go ahead and give it now. So I'm going to get my gloves on. Before I flush or give any medication, I always want to assess the site. So I'm looking for any pain or redness, swelling, making sure the dressing's clean, dry, and intact, and it is. And John, do you have any pain when I touch around here? Any discomfort?
Nope.
Okay, great. So the site looks good. Now I'm going to go ahead and pick my line. I've picked this one. I'm going to start by scrubbing the hub for 15 seconds. Okay, so it's been 15 seconds. Now while that dries, I'm going to go ahead and get my first flush ready. Go ahead and uncap that. I'm going to attach it. And I'm going to unclamp my line. And then before I flush, I just want to pull back a little bit of fluid and make sure I see blood in my line. And I do. So now I'm going to go ahead and flush. The first 2 mLs, I'm just going to go slowly, checking for any resistance. And I don't feel any, so now I'm going to do the rest with a pulsating technique. And while I'm doing this, I'm watching the site for any swelling, any leakage, John, does that feel okay?
Yep.
Okay, great. Okay, so I finished with that flush. Can remove. And I need to clean the side, or clean the hub again. I'm gonna do it for 15 seconds by my watch. Okay, it's been 15 seconds. Now while that's drying, I can get my medication ready. Again, maintaining sterile technique, aseptic technique, sterile technique. Okay, so that is dry. I can go ahead and attach the drug. And now, again, I have to administer it 25 milligrams in the 1 ml, not to exceed 60 seconds. So I'm gonna go ahead and watch my watch and probably give it in about 45 seconds or so. Just using a pulsating technique, nice and slow. And while I'm administering, I am watching the site. Again, making sure there's no redness, swelling, leakage. John, how does that feel?
Good.
Feels fine, okay. So we're a little more than halfway. And there we go. So that was about 40 seconds, which is within the time. Go ahead and release that. Now I'm going to scrub the hub again before I do my last brush. So 15 seconds. Okay. Now while that dries, I'm going to get my last flush ready. Okay, that is dry. So I'm going to do my flush. And again, the first ml I'm going to give at the same rate that I gave the drug. So it's going to be over about 40 seconds that we'll do that first ml. Again, by my watch. All right, so now I'm just going to pulsate the rest of that through a little bit faster, but not too fast. And I'm still assessing the site, watching it as the flush goes through, just making sure there's no redness or swelling or leakage. John, you still feeling okay?
Yep.
All right, almost done. Okay, so now I have flushed. I'm going to go ahead and reclamp my line, and that is done. So now I'm just going to do one final assessment. Site is clean, dry, and intact. No redness, no swelling. I'm just going to palpate a little bit. John, how does that feel?
Good.
Feels fine? Okay, everything looks great. So I am done. I'm just going to go ahead and clean up all my stuff. Throw it away. Remove my gloves. Wash my hands one last time. Very thoroughly. And that completes my return demonstration.